Hello there, my name is Gillian McCabe. I'm a specialist pelvic health physiotherapist and I am the owner of Gillian McCabe Physiotherapy in Cardiff in South Wales. I'd like to introduce myself today and just help you to get to know me a little bit, what my background is, how I've come about into this business and maybe how I can help you in the future. So first of all, if I tell you where I've come from, I went to university to study a physiotherapy degree in the University of the West of England in Bristol. I really enjoyed my time in Bristol. Hello to any of my friends and colleagues, housemates from Bristol. I hope you're doing all right. I graduated from the University of the West of England in 2004 with an honours degree in physiotherapy, and I moved straight back home to Cardiff. Any of my friends from university will know that I travelled home every weekend. I got very homesick and Cardiff was my home. I wanted to see my family and be in my church every weekend. So that was a big thing for me. So as soon as I graduated, I was back down the motorway as quickly as possible to try and get a job in Cardiff. I went for numerous interviews. It wasn't easy to get a job in physiotherapy at that time, but eventually I managed to get a rotational post as a band 5 or junior member of staff in a physiotherapy team in Newport. I worked there in St Willows Hospital for a little while before I managed to secure a job in Cardiff Vale University Health Board in Landock Hospital, doing rotations every 5 to 6 months, I think it was, in various specialties in physiotherapy. So I worked through those rotations until 2006, where I was offered a longer rotation, more specialist rotation as a band 6 physiotherapist, or as it was called then, a senior 2 physiotherapist in women's health, and this was a 6-month rotation. I kind of went into that rotation kicking and screaming. I didn't want to do it. I didn't know much about women's health physiotherapy, as it was called then. I'd had maybe 2 or 3 lectures in university in Bristol and didn't think much of it, and it wasn't really part of my plan to be a women's health physiotherapist, but thought, right, no, this is the rotation that I've been given and I'm going to work my best, try and get the most out of that rotation. So I did my 6 months, absolutely loved it, under the education of Mrs. Carol Broad, who's clinical specialist physiotherapist and clinical team leader in that post still now. So thank you, Carol, for giving me the enthusiasm and the motivation to continue in this specialist field, and such a rewarding field of physiotherapy it is too. So you instilled that passion in me. And after 6 months, when I was called by a fellow on the rotation wheel behind me, panicking a little bit about him having to do women's health, I very quickly jumped on the opportunity to do another 6-month rotation. I did that again until I'd completed 18 months. I then rotated out into a community post with the acute response team in Cardiff, which I absolutely loved. But within 6 weeks of me being there, a static post in Cardiff and Vale came up, and I went for it in women's health, which meant that on achieving that job I was able to put all my passions into action and find out as much as I could about women's health, pelvic floor rehabilitation. So that was a very exciting time for me. So from then on, I just continued to learn and treating patients, getting satisfaction out of helping patients with problems that are seen as quite a taboo. And I kept working and decided to seek funding for a master's degree, which I started back in 2008, the end of 2008, and continued gradually until I achieved my master's degree in pelvic health physiotherapy in 2015. I was the first physiotherapist in Wales to achieve that level of qualification, although previously a lot of the physios would have studied to that level, but not actually been recognised as having master's level qualifications. So I was very, very grateful to be the first physio in Wales to achieve that level. With that graduation, I put my dissertation into practice in dealing with pregnancy-related pelvic girdle pain within the NHS, trying to reduce waiting lists, improve the service in Cardiff and Vale, and successfully reduce the waiting list down to 8 or 9 weeks. This improved the situation in terms of the waiting list, but with reduced waiting lists comes at a cost, and the quality of the treatment potentially, from looking back, wasn't the best that it could be. So we carried on working along that line. However, in 2016, in September, I was offered an opportunity to hire a room in a private clinic in Infiniti Healthcare, owned by Mr. Bowel, consultant urogynecologist. He offered me this opportunity, and with a business that I wanted to set up, I went ahead and decided to go part-time into private practice. At this point, the business grew and grew. There was a lot of need out there for pelvic health physiotherapy, as timely as possible, good quality care from practitioners that are well educated, sensitive, and able to deal with a complex range of problems. So I decided in January 2017 to hand in my notice within the NHS, which was a very difficult decision to make, but I do feel it was the right decision for me at the time. And I focused all my energies on my private practice, which is now running really well. It's very busy, I'm really enjoying myself, I'm learning a huge amount from seeing a range of different conditions that maybe I wouldn't have had access to in the NHS. I've built up some really good relationships with other private practitioners in the medical field, allied health professions, the fitness areas, so I've managed to build those areas up as best that I could. So that's where I am at the moment, and I want to finish this video with just giving you a little bit of advice as to whether you would benefit from coming to see someone like myself, a pelvic health physiotherapist. I'll do another video at another date and pop that onto my channel and onto my website. In terms of the clients that I would see as a pelvic health physiotherapist, and if you're watching from elsewhere in the UK or globally, every pelvic health physiotherapist will be able to deal with these conditions. There's varying emphases within pelvic health, various passions within pelvic health in terms of the clinician that you may have access to may be very well educated in an area that I haven't heard much about, but the basic standard women's health or pelvic health physiotherapy involves dealing with anything that relates to the pelvic floor or the pelvis. So we're talking about incontinence of the bladder or the bowel. We're talking about vaginal prolapse, we're talking about constipation, we are looking at ways of dealing with chronic pelvic pain in various disguises, whether it be from a musculoskeletal version of the pain, a bladder or bowel version of the pain, vaginal changes, for example during the menopause. We're looking at athletes, we're looking at, say, more of the elderly population, lots of different areas where we can delve into chronic pelvic pain. We're also looking at pregnancy-related conditions, so the most common conditions in pregnancy would be your back pain, pelvic girdle pain, sciatica, and less common the thumb tendinitis, carpal tunnel syndrome, difficulty with the abdominal muscles, possibly a separation of those muscles which can then transfer into the postnatal period. I offer the pregnancy pit stop as a screening mechanism during pregnancy to help women to find out if they're at risk of any problems, if there's anything that they can do and be proactive about to help reduce those risks and reduce any problems that they might be experiencing. And then I also run the Mummy MOT programme, which was set up by Maria Elliott in London. I was really happy to bring that to South Wales, as an option for women, where they can receive a 6-week postnatal checkup looking at their back, their posture, their breathing, their abdominals, their pelvic floor muscles, anything that would relate to their ability to carry out life as a mum. So the mummy MOT is a great option as part of pelvic health physiotherapy. It doesn't have to be at 6 weeks postnatal, it's ideal at that point. Your body is ripe for healing at that point, but I've had ladies whose children are in their 20s and 30s coming in for a mummy MOT and seeing great results from their core programme that follows. So it's worthwhile just seeing if that's something that you need. The other issue postnatally is the diastasis rectus abdominis muscle, where your six-pack muscles separate. I use that as part of the assessment process in the mummy MOT, but quite often if there's pelvic floor issues, if there's musculoskeletal back issues, the link between the core and the pelvic floor is undeniable. So in any assessment that you come in for, you will find that it is very similar to a mummy MOT. So it's worthwhile coming in if you have any concerns about your pelvic health, your pelvic floor, anything that might have happened pre-pregnancy, during pregnancy, postnatal, anything that you might be struggling with in later years after childbirth, during the menopause or after the menopause. If you're concerned about anything to do with your pelvic health, go and find a local pelvic health physiotherapist. They are out there. There's a huge network of physiotherapists available, not only in Wales or the UK, but across the world. I'm part of a number of Facebook groups of amazing professionals with such amazing skills and such passion for what they do. Wherever you live in the world, I can guarantee you that you will be able to travel not too far a distance to get to your local pelvic health physiotherapist. So it's worthwhile either contacting me to find out where they are. If you live in South Wales, there's myself, and there's also Jilly, who works in private practice. You've got the network of NHS hospitals with women's health physiotherapy departments there. There's a growing concern about the lack of men's health. I know Jilly provides men's health physiotherapy. I don't currently provide it at the moment. In the NHS it is a bit sporadic, but we are trying to deal with it with different task and finish groups within the Welsh Government. I know that there are a lot of physios out there who are able to help men as well as women with pelvic health complaints. So whatever your concerns, feel free to browse my website. There's plenty of information here. If there's anything that you still are not sure about, if you want to ask some questions, either follow me on my Facebook page, on Twitter, I'm at Gillian McPhysio. I am on Instagram as Gillian McCabe Physio. I am also on LinkedIn if you want to network with me on a more professional basis. There's lots of ways to contact me. You can contact me by phone. My mobile number's on the website. My email is on the website as well. If you've got any questions, feel free to contact me. If you feel like you want to book in an appointment and you live near to the South Wales area, there is a booking tab at the top of this website, or you can go to www.gillianmccabe.co.uk and then search for the booking tab at the top of the website, and that system takes you through a really simple way of finding the best location, the best date and the best time for you to come in. In terms of locations, I'm based in 3 different locations at the moment. So on a Monday morning I'm at Waterside Therapy Rooms, home of Nicola Ruth Sports and Pregnancy Massage in Atlantic Wharf in Cardiff. That's near the bay. So between the bay and the centre of town. And then on a Monday afternoon and evening I'm in Cowbridge Health Centre, which is in the Vale of Glamorgan, in a lovely village where you can come to have your appointment and then go for a lovely lunch or a coffee afterwards and browse the shops. There's some lovely boutique shops there. It's always nice for an afternoon out. And then Tuesday, Wednesday, Thursday and Saturday I am in Ashtree Private Medical Clinic. I hire a room from Infiniti Healthcare in that clinic, which is at Cardiff Gate Business Park, and that is just off junction 30 of the M4. All directions to each clinic are on my website. So if you're booking in an appointment, I look forward to meeting you, but hopefully you have found this video useful, and I hope that if you do have any questions, do feel free to contact me. I'm more than happy to discuss any questions that you have.